Can a traditional CO2 fully ablative laser resurfacing get rid of these acne scars? The other option a doctor offers is the deepest phenol peel, called the Baker-Gordon peel. He says this peel goes deeper than the CO2. What would be the better treatment with better results? Answers would be very helpful. Thank you.
Thank you for your question. You submitted a photo of the cheek area, and you're asking about getting an opinion of comparing CO2 laser versus getting a Baker-Gordon peel to treat acne scars. So I think I can give you a little bit of perspective, and it's probably going to be different than what you've heard, what you're going to hear from a lot of colleagues. I'm a board-certified cosmetic surgeon, a fellowship-trained oculofacial plastic reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. And I think that what we can do is give you a little bit of perspective based on my experience doing this for this long and my observations of what happens to skin over time. Now, with the photo you submitted, it's clear that it appears that you're younger and that there are multiple typical acne cheek scars. Now, one thing that I can tell you from seeing patients over the years is that the concept that you are basically dealing with is that when you had acne, you lost volume of skin. And so there are small depressions, and those depressions are not just depressions, but there's scar tissue underneath. So one of the things that is done in acne procedures, acne scar procedures, is something called subcision, where we actually place some type of a special type of blade under the acne scar and release it, because it's not just that the inflammation causes some scarring. There's a depression or loss of volume in the dermis, and there's a band of scar tissue underneath. So you think about it, what are we doing when we do lasers or peels? We're taking the adjacent skin and making it more even with the more deeper skin in terms of or I should say relative depth of the acne scar. In other words, we're trying to create less contrast between healthy, normal skin and acne skin. Now, it's been my observation that with patients who have had peels in the past and lasers in the past, especially when they've done multiple procedures, aggressive procedures, not fractionated, limited procedures, but aggressive procedures, the skin gets thinner. And in many ways, effectively, you're sacrificing good skin to match the depth and continuity of scarred skin. So in my practice, when I meet with someone like yourself, I explain to them that there's never going to be a point where you'll have perfectly smooth skin. It's not practical for someone who has suffered from this type of acne type of scarring. But rather, what we want to do is try to take the attention away from the areas which may draw somebody else's attention or draw the patient's attention. Now, what we've been doing is we've actually been using platelet-rich plasma in combination or with a hyaluronic acid filler to try to build up the skin under the scar and to try to soften that transition, but rather than from an ablative method, but rather by adding volume. So I think that what we're looking at is a new concept of regenerative medicine. Now, of course, fillers have always been around to help people with acne scars, but I've found that many patients who have chronic problems with acne scars, and they bounce from doctor to doctor. Some offer lasers and do lasers, others offer fillers, but a lot of times these patients are so frustrated, they just keep looking for one new solution after another. So I always explain that if we're going to do something, we have to be on some type of plan so that we can really be strategic and intelligent. Now, I found that the use of PRP, platelet-rich plasma derived from your own blood, softens the scars, improves the quality of the skin, and in combination with hyaluronic acid fillers, helps to plump up the skin. And there's been clinical studies for wound healing showing the synergistic and long-term improvement based on more permanent, what's called fibrovascular ingrowth, which means there's actual tissue that grows in as the hyaluronic acid disappears. Now, we treat everybody on a case-by-case basis, but I think what I'm trying to say is essentially I would avoid any type of aggressive deep peeling at a younger age and see if you can try to regenerate and rejuvenate the quality of the skin, because, like I said, you can't completely eliminate the scars, but you can improve the skin quality. And over a period of time, with the right treatments, you can really reach a better place without going through the trauma and long-term loss of a very young skin. It's different as you get older, but then things change in terms of the facial volume as you get older. So I would suggest that you explore this idea of regenerative methods using platelet-rich plasma, hyaluronic acid fillers, subcision, and some ablation. We sometimes combine this with limited fractional CO2 laser, but I try to do whatever I can to maximize the skin quality before doing something ablative. So I hope that was helpful. I wish you the best of luck. Thank you for your question.